All right, good afternoon, everyone. Welcome to our webinar. We are going to get started with the presentation shortly. We are waiting for a few more people to join before we get started this afternoon. So for those of you on the webinar already, thank you for your patience, and we'll be back shortly. Thanks. All right, good afternoon and welcome, everyone. Welcome to our Rules of the Road, Timelines and State Protections Contracting webinar. Today is February 17th, and my name is Meg Beyer. I work at ICL in MCTAC, and my colleague Boris Vilgorin will also be joining me on the webinar today. I'm just going to run through a few basic housekeeping rules before we get started. So for those of you who have joined our webinars before, this might sound a little repetitive. For those who are joining for the first time, just a couple things to run through. If you'll notice on the right-hand side of your screen, we have a chat box capability. We will be taking questions and answers at the end of today's webinar, so I would encourage everyone, if you have any question, to chat in your questions early and often. What happens usually with these webinars is we get a whole bunch of questions right at the end, and it's kind of tough for us to sift through. So if you could chat in your questions throughout the entire webinar, that would be great. Also, just to let everyone know, we are going to prioritize answering the questions that are directly related to the content for today's webinar. I know there's a lot of questions out there, and this is a great opportunity to ask them, but we are, just given the shorter nature of today's webinar, going to focus on the ones that are related to contracting and state protections. We will be collecting all of the questions, and we'll work on a document to answer those later on. The slides from today's webinar are posted at the MCTAC website, which is mctac.org, and this webinar will be recorded. It is being recorded, and it will be available soon on MCTAC's website. So if you visit our website, we have all of our resources and previously recorded webinars listed there. And again, questions not addressed today will be revisited during subsequent presentations. Also, if I could request, if you are chatting questions in, there is a drop-down category. If you could select all panelists, that way everyone can see the questions that are chatted in. And just a reminder, as this is going to be recorded and posted on the MCTAC website and will hopefully be listened to in the future, all of the information and timelines are current as of today, Wednesday, February 17th, 2016. So just to keep that in mind as things might change in the future. Okay, so this is just a brief review of the agenda for today. I'm going to walk through a general overview of MCTAC, talk about contracting, credentialing, and billing timelines. Boris is going to take it away with state protections, talking more about contracting and credentialing, and then I'm going to talk about upcoming events and tools. Okay, so for those of you who might not be familiar with MCTAC, MCTAC is a training, consultation, and educational resource center that offers resources to all mental health and substance use disorder providers in New York State. So we provide these resources to all behavioral health providers in New York State. And our goal is really to prepare and assist these providers with the transition to Medicaid managed care through training, developing resources and tools, all around getting ready for managed care, and specifically around quality improvement strategies, business and organizational, and clinical practices. Who is MCTAC? MCTAC consists of a strategic partnership between the McSilver Institute for Poverty Policy and Research, which is housed out of the NYU Silver School of Research, as well as the National Center on Addiction and Substance Abuse, also known as CASA. So MCTAC really consists of this strategic partnership between McSilver and CASA. MCTAC also consists of many partners across New York State, both provider and agency organizations that really contribute to the different areas of expertise that MCTAC provides training and resources around. Right now, I'm just going to walk through very briefly contracting, credentialing, and billing timelines. This information shouldn't be too new. This hasn't changed recently. So as of April 1, this is again a timeline that is geared. This is for rest of state implementation. So not New York City-based providers, but rest of state providers. So the April 1, 2016 date is the first phase of HARP enrollment letters being distributed. This is going to be done in a 3-phase process. So the first batch of letters will be sent out April 1. July 1, 2016 is the go-live date for Mainstream Plan Behavioral Health Management, and this is also the date that the phased HARP enrollment begins. And finally, on October 1st, 2016, home and community-based services are going to be made available to individuals who choose to join a HARP. And a HARP, again, stands for Health and Recovery Plan. Again, this is just a timeline around contracting, credentialing, and billing. So this is a timeline to kind of guide providers as to what they should be doing to really prepare and get ready for this transition to managed care. So really looking at focusing on contracting and credentialing, this should be done around between February, March, and April of 2016. Claims testing should be done, starting to be done with the plans that you're in contract with. Starting in April, May, and June would be the months you focus on claims testing. And then really thinking about billing and preparing for billing starting in July, August, and September, and then ongoing. All right, and I'm going to shortly pass this off to my colleague, Boris Vilgorin. But before I do, I just want to encourage everyone, if you do have questions, just remember to chat them in to the chat box on your right-hand side. And with that, here's my colleague, Boris.
Good afternoon, everybody. First, let me apologize because I'm fighting a cough, as it seems like it's been going around. So hopefully I won't get one of my fits during this presentation. And as we go through the state protections, let me just underscore what Meg just said. One is this presentation is focusing on the rest of state adult transition. And it's for and when we talk about HCBS, it's for adult behavioral health HCBS. There are other efforts and presentations that if you also provide services to children, that hopefully you have participated. There's also other events that are being planned for this. So this focus, again, is on the adult transition to managed care in the rest of the state, and also, of course, the adult behavioral health transition. HCBS transition. So I just wanted to underscore that and then jump into the state protection. We also want to make sure, and one of the reasons we're doing this webinar, and we'll go through the dates later on, is really preparing providers for the contracting fairs that are going to be happening throughout the state. And again, Meg, at the end of the webinar, we'll go through those dates. Hopefully, you got those notifications and been able to register. We've been working closely with all the plans. They're very much cooperating and working with us, and we're looking forward to those contracting fairs. And so this is kind of, again, give people some sense on some of the rules of the road, as we said, and some of the things that might help in better and smoother contracting fairs. We did one in New York City which was very successful. It was attended by a lot of providers, all managed care companies, and we heard both from the plans and providers on how successful it was, and so our goal is to recreate that. So with that being said, let's go through some of the basic overview. Just to mention, and we're going to do also utilization management and billing, which will we'll go into a deeper dive in regards to the billing. But just to give folks a couple of basic elements on the billing is all electronic claims we'll be submitting using the 837I, which is institutional claim form, or UB04, which is a paper claim. And that's important. If you look at the billing manual that's on the OMH website and others' website, this will be reinforced there as well. Plans will be required to pay 100% of the Medicaid fee-for-service rate, or as we call them, government rates, for all authorized behavioral health procedures delivered to the mainstream Medicaid managed care plans. And that, of course, includes for HARPs and HIV SNPs and so forth. And this is for the OASIS and OMH licensed providers, or certified or designated. So again, the question keeps coming up, and we just wanted to remind folks and reinforce that there is a requirement by the plan. So when you go through the contracting process, make sure that that is reflected. All the plans are aware of it, that they should, have to provide the Medicaid rates for that. So this particular slide has a lot of words, and so I'll try not to read the whole thing, but I think what we want to do is reinforce, and a couple of times where lessons learned from New York City is that part of the contracting, there is a credentialing process, and a provider is not fully in network or fully contracting unless they went through both the contracting and credentialing. And we'll underscore this again later on. But when we refer credentialing, what we mean and what the state means is that the managed care companies will credential the providers. However, it would be at a facility level, and that's what a lot of what this slide really talks about. Of course, you have to be an OMH or OASIS licensed program or certified by either of those state agencies. And what that means is, you will still get an application that you have to complete, but it'll be at the facility level. It will be not at the individual employee provider level. Some managed care companies might request a roster, just indicating the individual's names and so forth, but it is not a credentialing process where you have to submit their license or their DEA or anything else. So we just wanted to underscore, one, there is a credentialing process. It is a shorter process and at a facility level. And again, as you go through it and reach out to managed care companies or talk to them during the contracting fair, please keep that in mind, and I'm pretty sure the managed care companies will remind you of that as well. The other piece, coming back to the billing, there is a prompt pay law, that's New York statewide law, that requires the plans to pay an undisputed claim, which also known as clean claim, to the provider within 45 days or within the 30 days if you submit electronically. So that's another incentive to submit claims electronically. But if you submit it on paper, the managed care company does have up to 45 days to pay the claim. Otherwise, they have to pay within 30 days if it's electronically, and it is a state law. Other elements to consider and to remind folks of, that plans are also required to contract with a provider who has 5 or more of their enrollees/members, and also with OTP, since it's an essential community behavioral health provider, the plans must contract with all of them. Excuse me. So again, if as you look through your individuals you currently serve, if you have 5 or more of their enrollees, the managed care company is required to contract. In our experience, at least in the city, that plans were very much willing and interested in contracting with almost, if not all, providers. We at least have not heard any plan turning away any provider. So I think it's really going to be, from our experience, more on the provider side to be willing to contract and to move through the process. But again, at a minimum, they have to contract with you if you have 5 or more. There's a payment requirement. Again, just to underscore that the plans will pay government rates for the first 24 months, and the 24 months, will be as of July 1st for the rest of state. It's different for New York City because it went live on October 1st, but it's 24 months, which includes APG rates. The plans will be utilizing the 3M grouper as needed and as they have done before for especially the APG services. And the claim construction is going to be very similar to fee-for-service. Again, we'll be doing a more in-depth presentation on claims and actually going through field by field with the managed care companies present and going through if there are any nuances by plan. Those, again, you'll see the dates for those, and the announcement will be coming shortly. We did that in New York City. That document is posted on our website, and we're now in the process of adding the rest of state plans to that document. So there'll be a much more in-depth discussion on the actual claim construction. And plan readiness, again, as part of the overall rigorous review process, the plans must test and demonstrate readiness to process claims. So one of the key components here is that plans must test claims, but of course they can't test them if you as a provider do not submit claims to test both for your system and their system. So there is a lot of encouragement that's happening now and will be, to make sure that you test claims. One of the key components here, as Meg went through the timeline, it's very difficult or almost impossible for some plans, if not all, to test claims if you're not a contracted provider and credentialed. So it's very, again, strongly recommended that you keep track of that timeline and move through that process as fast as possible, and not get into a situation where you're doing what we refer to here at MCTAC as live testing, meaning that you're billing already because it's July 1st or after, and really not sure what's going to happen. Electronic claims, again, for OMH licensed clinics and OASIS certified clinics and OTP programs, the state director, the plans must accept the 37I with the APG codes, HCPCS codes, which are posted on the state sites, and we have them as well. So for those programs already currently utilizing A37I, just need to make sure that you still attend those trainings and webinars and so forth to see how, if at all, any changes are being put forth to make sure that your current billing system meets the potentially new requirements. And as I said, again, we'll have a more in-depth in-person presentations on that. Contracting and credentialing. Can't say enough about completing both. Again, to underscore new contracts versus established, so a number of providers might already have contracts with existing managed care companies, especially Article 31 clinics. Again, please talk to the plans that you have contracts with. For you, it might be a possibility that you only might need to sign an amendment or an addendum to your contract, but that you really need to discuss directly with the plan and based on their rules. But that might be, a shorter route, if you will, to you. And of course, if you currently have no contract with a particular plan or any managed care company, you would have to go through the full contracting and credentialing process, which will take a little longer than just signing an amendment or an addendum to your existing contract. The state protections, I think we already went through that, so we wanted just to make sure folks got it. And again, the technical assistance that we're going to be offering is ongoing contracting webinars and contracting fairs that are coming up. And with that, I'll turn it back to Meg for the upcoming events.
Thank you, Boris. So I'm just going to walk through some of our upcoming events. Again, I just want to direct everyone to mictac.org for more information and to register. Right now, we have, as you know, been doing some webinars. We have the overview that we hosted on the 10th, and then we also have the webinar from today. So again, these will be recorded along with the slides. They'll be posted on mictac.org. We do have upcoming in-person contracting fairs for our rest of state providers, and they are coming up on the dates listed below. They're starting in about a week and a half. So be sure to visit MCTAC's website for more information about location and whatnot. They start in Buffalo on Monday, the 29th of February, Leap Day, and they proceed with Syracuse on Tuesday, March 1st, Albany on Wednesday, March 2nd, and then we jump to the Hudson Valley. We'll be having an event in Poughkeepsie on the 17th of March. We'll be having our contracting fair at the Long Island Plainview Marriott on Friday, March 18th, and we'll be having a smaller contracting event in person in Lake Placid in the North Country. We're still working out some of those details. We also are going to be having some and billing in-person events. These actually have yet to be open for registration, but they will be shortly. We wanted everyone to see the dates as soon as possible. So again, these are happening towards the end of March and early April. And visit mctac.org for more info and be looking. MCTAC will likely announce these events and open up registration for the and billing events very soon.
So I just want to jump in on the February 29th in Buffalo and Syracuse March 1st, assuming there's no 2-foot snow, as just recently happened in Rochester. You know, we're definitely, but we'll of course keep everybody informed if there's any weather issues. And if there are any major weather events, we will definitely reschedule and make sure that we have the contracting fairs.
Yes, thank you for that, Boris. Okay. So these are some of the documents that we referenced throughout the presentation today. When you look at the slides on our website, you can actually just either copy and paste these links directly into a browser or click on them. Again, this is the HCBS service manual. We have the HARP and mainstream billing manual, and then we have the fee schedule and rate codes as our final item on this list. We also wanted to make sure everyone was aware of the managed care mailboxes that both OMH and OASIS have created to really get direct provider feedback. And as you can see, there's the OMH mailbox and then the OASIS specific mailbox. And as you can see below, there's actually specific forms that both offices have requested providers fill out just to kind of better keep track, have better response times. So if you are going to submit a question or concern to these email addresses, please be sure to click on the link that will be embedded within each slide and use the form provided. And then finally, we are at our question and answer portion of the webinar. So I just want to, again, encourage everyone to chat in your questions. And for everyone who hasn't already, to not only visit mctac.org for all of our past trainings, resources, tools, and event announcements, but also if you haven't signed up, do sign up for the MCTAC newsletter. This is kind of the basic way that we announce all of our events, send reminders, make announcements about any policy update or any tool that's been developed. So I would highly encourage everyone, if you haven't already, to register for our newsletter. And with that, I'm going to pull up some of the questions that we've gotten today.
Right. So while Meg is pulling up the questions, the other piece just for the contracting fairs, just to remind folks, and hopefully you got that as part of the announcement, is our colleagues at CCSI put together, in collaboration with the plans, a nice survey or a fact sheet that we think and the plans think would be very helpful, that as you come to those contracting fairs, that if you can come prepared with them being filled out as much as possible, so when you talk to the managed care company, you can leave those fact sheets with them. So we strongly encourage to make at least some copies so you can leave it with every plan. And this also gives you an opportunity to highlight your agency, the services, the contacts, and not just the business card. So please make sure that you complete that, bring it with you. If you don't have it or not sure what I'm talking about, please email us, and we will make sure to get that to you. But it should have come with an announcement, and as we're going to remind folks about these fairs, we will make sure to include that again on those.
And so actually, our first question that came in was about who will be at these fairs. So will the MCOs be at the fairs?
Yes, definitely. So the way this is structured, so thank you for the question, is we provide tables to the MCOs, and of course, it's regional. So depending on which MCO is designated for which region, will depend on how many MCOs are going to be present. So I think in Buffalo we have 5 or 6. As I've mentioned, and I think Meg, we've been meeting with the plans to prepare for this. They get at least a table or 2 or 3, depending on each plan and how many tables they want. They bring their own information. We encourage them to come with contracting people or other folks to the fair and be able to do this. We also provide an opportunity, and it depends on the flow and how many people. Sometimes it varies. An opportunity to sign up by like 10-minute increments. It's almost like speed dating a little bit, but we don't stick to that necessarily, depending on how things flow. You can have more time or less time to talk to the plans. So there is an opportunity to, kind of schedule an appointment, if you will, as well. But our goal, and again, as I said, in the city, we had all 10 plans show up, and our goal is that every region has all the plans that are pertinent to that region show up.
All right, thank you, Boris. We're going to take just 2 seconds to look for our next question, so just hold on one moment. Okay.
So there's a question about a timeline about hiring and training of HCBS staff, program planning, just billing. Is there guidance available for their implementation? So I think as time progresses, so as you saw in the timeline, the adult behavioral health HCBS services in the rest of the state, that's a mouthful, is not going to go live, the actual delivery of services, till October 1st. I think what we have learned in New York City, at least, and it might be different in your neck of the woods, is that it is not as a quick uptake in regards to number of individuals who are assessed. There's a large number of enrollment into HARP, which is different than being eligible and then taking advantage of HCBS services and going through an assessment. There will be numerous trainings. We will be conducting numerous trainings on HCBS, both in person and webinar, both with OMH and OASIS as our partners. We will be announcing those as we get a little closer to that, both about the services, the philosophy, and billing. And I think we can talk more about hiring or holding off hiring staff or whatever might be as we get closer to that.
Okay, thank you. All right.
Okay, we're just looking through some questions.
Yeah.
So there's a question about Child Health Plus. I'll punt that to our children's group that does the presentation. My understanding, just quickly to answer, the Child Health Plus is not included in the managed care transition. But again, I strongly encourage you to participate in the children's webinars and in-person sessions that I think are coming up, and there'll be probably more discussion about that. Go ahead.
So we are getting a lot of questions about the provider form. I think what will probably be happening is that we're going to send out an email that contains the form. so that providers can get it that way. I would recommend people visit the MCTAC website and just make sure that you're registered for these events, and that way you can get the provider form.
Right. So, and just to underscore, provider form is not a requirement of any sort.
Right. It's not a requirement.
To come to the fair or to participate. We just thought, and the plans agreed, it's a nice way to organize some of your services, because in the past, we've seen providers come with their packet, which is great, and you can still do it, but sometimes those packets include everything you do, and everything you do might not be necessarily too pertinent or at the moment something the managed care is interested in. There may be something they're interested in down the line. And so we wanted to make sure that what they're looking for in the moment, because it's about contracting and credentialing, is highlighted, and that they have information to follow up with you.
Thank you. So we got another MCTAC-related event question that I wanted to take quickly, and it's a great question. We're constantly trying to fine-tune our announcements and our engagement out to providers. So someone asked about the future formats for different in-person events. And we actually do have in our announcements a structure that we put together to kind of not only discuss the format of the events, whether it will be a presentation or whatnot, but also if it's going to be recorded, if it will be repeated in other locations, who from your organization should attend. So I would, again, just encourage everyone to familiarize yourself with the MCTAC website, because that information is contained there, and also to sign up for our email list, because we do include all of that information on the announcements that go out. Okay, we're going to look through some more questions.
All right, so there's a question about MCOs are able to cover only specific instead of covering the entire region. So the MCO process about the regions or the areas they cover is between the MCO and Department of Health. There are certain rules about it in regards to making a managed care company eligible to cover an area. And they go through the processes based on their business plan and based on, the membership and other things. So that is out of, our hands, of course. What we want to do is make sure that all providers are aware which counties and which areas are covered by managed care. I can appreciate, it'd be easier as a provider if MCO covered a particular region rather than just one county in that region. But unfortunately, that process is more of a collaboration between managed care, Department of Health, OMH, and OASIS.
Thank you, Boris. All right, let's dive back into the question.
Yeah. Okay. Please clarify the link of mainstream HARP includes HCBS, and then the link of HCBS manual is the service provider manual. Good question. We do get, and we're trying to clarify that. So the 3 links that we provided, just to be clear, and we're going to go back to those links. So the billing manual includes both HARP/HCBS services and all of the all other mainstream state plan services billing manual. So it's an all-inclusive. The HCBS manual is very specific to HARP and all the HCBS services and what it, kind of the rules of it, what it's intended to be, and what type of activities for each service. It also has some staffing requirements and other things. Again, we'll be doing more of in-person trainings on the HCBS manual, and also as time progresses, we'll be doing more on the HCBS billing as well. But those are kind of the differences. One is inclusive of both HARP/HCBS and state plan billing, and one is very specific to HCBS. Okay, let's go to the next question here. hold on, let me just, because I think there are a couple of parts to the question. Will there be a UN Building in-person event in the Hudson Valley? We are looking into it. I'm not sure, and we'll try between the timing and everything else that's going on to see if we can accommodate that. Will MCOs be at the fair? We already answered that question. Okay, let's go through some of the other stuff. So, hold on a second. Okay, so the part of there's also a question about Lake Placid. It's small currently. Will other MCOs from other areas come up? We serve clients from all over the state, including New York City. How will that work for our situation? That's an excellent question. We'll bring it back to the plans in regards to it, and we also have to confirm, how when people cross these invisible borders between counties, who belongs where and how that gets covered, and and people definitely travel. So that's an excellent question. We'll bring it to the plans and see how they want to plan for that, and also, try to see if there's any data that we can obtain or plans or the state on how often that happens. So we'll get that. So thank you for raising that. So there's an interesting question. Does the rate have to be at the government rate, or can we attempt to negotiate a higher rate? So our understanding is the rates cannot be lower than government rates, but I guess your question is, can I negotiate a higher rate? I suspect that if you're able to negotiate a higher rate, the state would be okay with it, but then the plan, I believe, if I'm not mistaken, would need to get a state approval even for that. Again, I'm not sure why anybody would disapprove that. I do want to wish you, a lot of luck in negotiating, because right now, I think most folks are following. But if you're able to do it, that would be great. Okay, let's move on to the next question. Is there a list of MCOs available for each region? There is a list of MCOs available by county, and that is actually available on the Department of Health website. The way I usually find it, I usually just Google it, and I just say NYS managed care by county, and it pops up. That's something, Meg, we should consider putting a link or something on our website for the for folks who are visiting our website. But it is available, and again, DOH is the holder of that list. We're also creating a tool which will provide that information. We're actually creating a, it's going to be it's part of our matrix, which is already available for New York City. It will be added for the rest of the state, which when you click on each county will have the managed care listed there, and not just which managed care, but their contact information and so forth. If you go to the MIGTAC website today and click on New York City, it will give you a sense of how the rest of the state pieces will fall into it, and we're gathering that information from other plans. We actually, our goal is to have it available by the contracting fairs or soon after. Okay, let's see what else we have. So there's a question about, will MCOs being asked to provide list of services they will cover so that the individuals attending the fair. So MCOs they're going to cover all HCBS services. That is a requirement. And I think it'll be a question about what are you designated to provide, and and talking to the MCOs about it. But managed care companies are required to cover HCBS services and show network adequacy. just lost that word, with that. So is there a description of service listed on the provider info form? So that list of services came from the state, which, again, it's a comprehensive list of all the services. I'm pretty sure between OASIS and OMH on their website, but I suspect as an agency who fills that out, hopefully you would be familiar, and if not, I would suspect that you're probably not providing that service. I might be wrong, but at the moment, we don't have that listing. Okay, let's see if there's any other questions. There was a question about who can provide HCBS services. We're going to leave that to our HCBS presentations and where we do a more in-depth discussion about that. All right, let's give folks another minute or so if there's any other questions. If not, we'll take it from there. Excuse me.
Okay, so if anyone has any last-minute questions, if you could chat them in. Okay. So I think with that, I'm going to thank everyone for joining us today. Again, this recording and the slides will be posted on the MCTAC website. If you have any questions, we encourage you to email them in to mctac.info@nyu.edu. We might not respond within the first 24 hours, but we do try and get back to you as quickly as possible. And I think we have one more question, so great job chatting that in.
Yeah, so the question is, excellent question about HCBS contracting and claims testing. Will the time frame be slightly different? The answer is yes. I think we can safely say, and again, we'll do more on that, that it'll be shifted by 3 months because it's starting 3 months later. But I think some of you, if not a lot of you, have been already designated or in the process of being designated as HCBS providers. That's something you should already be putting on your list and discussions. But right now, that's what we're looking to do.
Okay.
All righty. And with that last question, again, as Meg said, for both of us, thank you for participating. And we hope, well, at least I'll be up in Western and Northern country to see you guys there at the contracting fairs. Thank you all.
Thank you.